Objective 13. This is where you're going to be able to go through clinical summaries. So clinical summaries can be printed or can be electronic. This is a new feature to 9.5. You guys don't have this in the current version right now. Basically, what will happen for this is when you get done with a visit, any visit for that patient, you can give that patient a clinical summary report of their system. So this is the screen that you would get for the clinical summary report. So you can actually put in who the patient is. That if you're in the patient's chart, it'll automatically know that you're talking about that patient. You can put in the from and to dates, and then you can put in which providers, and then which clinical information to pull in for that. So if it's going to be vitals, clinical elements, major problem list, so on and so forth. There's a check all and an uncheck all button so that you can just check all and it'll include everything on there. The required content to pull onto that is diagnostic lab results, problem list, and medication allergies. So what you have to do for this is you have to give this to the patient within 3 days of them having their progress note or coming into the office. One of the questions that a site had last week was diagnostic lab results. What if they don't come back in that 3-day time period? It's just whatever you have at that time. So and I think they're talking more internal labs for this. If all those labs come back in that 3-day time period, just shoot it out to them and you'll be good to go. So it's not talking about anything because it does take a little bit of time for certain labs to come back into your system. Just more than 50%. So it doesn't have to be everyone, but they're looking for more than 50% at this time. And this was a big point in last week's group that they didn't agree with either. But one of the things that you can do is if you have a checkout person, you can just have that person go through and either print that out, or if you look right here, there's a print to file option. So you could have it printed to file for the patient, and you can have that file waiting for them. You can say, hey, I have a copy of your clinical encounter, your clinical summary ready to go. Do you want that? And if they don't want that, you can just delete it. So that should count for that. Also, another question that people are asking is with the 3 business days, do you need to create an order for that? You don't, because that's based off of the clinical encounter of the progress note. So whenever that progress note was done, that's when it's going to start counting those 3 business days. So here's the denominator. Here's the unique set. So that's going to be the patients that have at least one clinical encounter where the provider is the provider who it was calculated, and the office visit date falls within that time period, and the number of patients in the unique patient set. The number of patients in the denominator who are provided a clinical summary of their office visit within 3 business days by the clinical summary.